Welcome to Our Canada, Our Future. I'm Aaron Woodrick. On today's show, we're going to jump right into the debate over COVID-19 vaccine mandates, passports, and restrictions, and explore the possibility that some of these measures may have actually done more harm than good. And to do that, I'm very pleased to be joined by Dr. Kevin Bardush. He's an affiliate assistant professor at the School of Public Health at the University of Washington, a Canadian. Kevin, I want to thank you very much for joining me today.
My pleasure. Thanks, Aaron.
Now, I thought, Kevin, we might start with your sort of academic background and interest. You've co-authored this very interesting paper. What led you to want to sort of dive into this issue?
Yeah, so I'm a social and political scientist, and I've worked on Ebola and Zika response at a global level for 15 years. And I was alarmed at the general direction of the focus on restrictions and mandates from the very beginning of the pandemic. In 2019, I led a high-level group of social scientists, and we evaluated how the WHO and other global agencies could better account for social science knowledge, right, in their pandemic response. I was also at the WHO headquarters in 2019 trying to get the emergency program to better appreciate the contribution of social scientists. And why I say that is that we have seen a tremendous amount of what are called unintended consequences, or also social harms from pandemic restrictions, lockdowns, stay-at-home orders, business closures, etc. And the vaccine mandates sort of kept on that trajectory, which really started in March 2020. And a lot of people don't appreciate that the sort of pandemic rule book, right, didn't actually advocate for the sort of level of heavy-handedness that the government, and I mean governments around the world, threw at this novel pandemic respiratory virus. So I think I've been skeptical from the very beginning about the excesses of our response. I mean, in disaster management, there's a very clear sort of accepted wisdom, which is don't panic, right? The excessive response, this sort of panic and disruption to society, often, with the wisdom of hindsight, is shown to be greater. The burden is greater than the actual emergency itself. And I'm afraid that in many cases, countries that took very stringent measures, whether you're starting to look at data on excess mortality from mental health disorders, etc., but also the consequences of liberty restrictions, and sort of the sense in the public psyche that the response was anti-democratic, the response was authoritarian, it was excessive, right? We're starting to see that, and it's affecting our political culture, and I think it's going to have long-term negative consequences on our democracies.
There's a lot there, and I want to unpack some of that as we go through the show, but I wanted to go back to something you'd said about the playbook for pandemics. I mean, this is something that you obviously had been familiar with before the pandemic, and what I take from your comments is that there was sort of, there are accepted approaches to dealing with pandemics in anticipation of them, and you're seeing that rulebook kind of got thrown out the window when an actual pandemic came along?
I mean, there's a lot of leeway here, obviously, and if we were dealing with a virus that had a different age distribution, so it's killing younger people at the same distribution that it's killing older people with COVID, and let's say a higher mortality rate, I think we'd be having a different conversation. But the age distribution of COVID was known in March, April of 2020, and yet we sort of ignored that fact. And the best way to appreciate this is that the Imperial College London models on lockdown in March 2020 by Neil Ferguson's group, and I've met Neil and I've had meetings with him about this particular issue, didn't account for voluntary behavioral changes, right? So people actually, oh, it's a novel virus, I'm going to stay home. And the social and economic consequences of lockdown. And so that thinking has permeated 2 years of pandemic policy. We're going to ignore how human beings actually respond to a disease, right? And we're going to ignore the social and economic consequences. So, yeah.
Wow. I guess sort of very quickly before the break too, I want to sort of stress this, that looking at, I mean, they're not talking about the effectiveness of vaccines themselves. They're talking about the consequences of how governments have sort of encouraged people, or in some cases coerced people to get them.
Yeah, exactly. The paper is focused on policy itself. We do, in the last section of the paper, we do talk about the deterioration in the trustworthiness of regulatory agencies in the way that they've handled public communication about the COVID-19 vaccines. And that is an issue that we're exploring in further work, especially with younger age groups.
Okay, we'll hopefully get into that a bit later. But right now we're going to take a short break. Welcome back to Our Canada, Our Future. We're joined today by Dr. Kevin Bardash at the University of Washington, talking about unintended consequences from COVID restrictions. There's a lot to unpack, Kevin, but I wanted to start with one of the consequences that you identify in this paper that you've co-authored, specifically on the impact on public trust. I guess I'll put to you, what did you and your co-authors discuss when it came to the impact of a lot of these restrictions and measures on public trust?
I mean, it's a really important question. I think that on the one hand, we pointed to inconsistencies, right? So the public, first of all, we have vaccine mandates, right? So this is not very I mean, there's some controversy about vaccine mandates, but we have school vaccine mandates, right? Those are typically implemented during moments of political calm, when the national temperature is low. Also, those vaccines have been around for a long time, which reduces the controversies by which the public interpret them. With COVID-19 vaccines, you actually had a situation where political leaders around the democratic world said, we are not going to mandate these vaccines. The WHO head of the emergency, not the head of the emergency program, but some vaccinologist very senior said, we shouldn't, in December 2020, we shouldn't mandate COVID vaccines. And then they sort of flipped the gun and then started mandating things. Now, when, let's say, the US and Canadian mandates started in sort of spring to mid 2021, there was a huge amount of data from the UK and Israel showing that these vaccines were not durable, meaning that they didn't stop transmission, right? And any intelligent and honest epidemiologist at the time would tell you it's transient. These are not, these are leaky vaccines. You're still going to transmit the virus. So we had this cognitive dissonance, this contradiction between, what was going on in other countries that started the vaccine programs earlier and what Canadian and American political leaders were telling the public.
Okay, and so, I mean, when you say that the vaccines didn't prevent transmission, was it a case of authorities maybe overselling what the vaccines would do? I mean, there's two things vaccines can do. They can help reduce severe outcomes. They can also prevent transmission. Right. And you're saying that rather than focusing on one, reducing severe outcomes, governments here were implying or saying outright that they not only would reduce severe outcomes, but they would also reduce transmission?
Exactly. I mean, the vaccines were sort of sold or marketed to the Canadian public as a means to end the pandemic, right, in quotation marks. That clearly did not happen, right? And what I'm saying is that was actually known before these vaccine mandates, passports, and restrictions based on vaccination status were rolled out in Canada. So essentially, you have a situation where somebody who makes the claim that the pharmaceutical industry has influenced these policies is not making a ludicrous statement.
Right, and I think it's fair to say that if you make...
If I could just follow up on that comment, I'm not an anti-vaxxer, but I do find it very interesting that in our society, questioning a pharmaceutical drug, whether it's an antidepressant or a heart medication, is considered acceptable. In fact, it's considered clinically necessary. What age groups need these drugs? And which age groups do the actual harms possibly outweigh the benefits? This is basic medicine, right? But with vaccines, we seem to be entering an area where rational discussion is not possible. If you voice any reasonable skepticism, saying, for example, young, healthy people that have had COVID shouldn't get vaccinated, right? You're suddenly thrown into a camp of a right-wing sort of irrational person. I think that it borders on this strange sort of hysteria.
Yeah, it's interesting. It's hard to think of another context where people would be eager to want things approved. If someone were to say, well, we need to get this drug a non-pandemic environment, most people would say, well, no, we should probably take our time and do this as carefully as possible. And yet we see the opposite during the
Yeah.
pandemic, partly perhaps because of the perceived threat. In terms of public trust as well, I mean, what do you think the long-term consequences in terms of public trust in public health authorities and political figures when they make claims about vaccines?
I think we've seen an incredible deterioration of the trustworthiness of our regulatory agencies. I'm speaking specifically about the CDC, which I know better than the Canadian context. I think that there needs to be a complete revamping of the regulatory environment for pharmaceutical products. There needs to be more transparency and honesty. And for example, there was a Freedom of Information Act request to the FDA and Pfizer to release the internal documents related to the regulatory process. The FDA asked for 75 years to comply with this, right? That presents an idea to the public like, hey, we're hiding something. That's unacceptable.
Welcome back to Our Canada, Our Future. We're joined today by Dr. Kevin Bardish at the University of Washington, talking about trade-offs from COVID restrictions and vaccine mandates and passports. Kevin, we were talking before about loss of public trust. I wanted to turn to concerns about vaccine hesitancy. Now, it's not new that there are some people who are skeptical about the effectiveness or the safety of all kinds of vaccines. As a result of the pandemic, of course, vaccines, specifically the COVID vaccine, are a lot more prominent now. What do you believe has happened as a result of these measures surrounding, really encouraging or in some cases, arguably coercing people to get vaccines?
Yeah. I think it's backfired tremendously. I daily talk to, I'm a social scientist, so I'm always curious and talking to people, asking them their opinions. On a daily basis, I encounter people who say to me, I received all of my vaccines. I will never get a vaccine again. Hands down, right? I have not gotten my children vaccinated because I no longer trust vaccines. I no longer trust our public health authorities. This is occurring at a global level. I'm happy, doing a lot of work in Africa. I'm happy that African governments didn't mandate COVID vaccines. I think that would have been a disaster going forward on the continent. In Canada, we face this very polarizing situation where people who got vaccinated, third dose, possibly even fourth dose at this point, and they haven't been exposed to any reasoned arguments. For example, why if somebody had a prior infection, they don't need to get vaccinated or they don't feel like they need to get vaccinated. If they haven't been exposed to that perception, right, they're living in sort of a bubble on this side. On the other side, right, there's people who very strongly believe that the vaccines are fundamentally dangerous. And I think it's very difficult in that polarized environment to have a conversation, again, going back to what I was commenting on. What are the benefits of these vaccines for specific age groups? They differ, as with any pharmaceutical product. I think if the government had, for example, in the UK right now, they are not recommending boosters to young, healthy adults under 40 years old, okay? The US government and the Canadian government are taking a very different approach. Denmark is no longer advising children and young adults to get vaccinated for COVID because everyone's had COVID already. And we know, and this is one of the major things, one of the major hiccups of this whole vaccination program, the denial of the human immune system. Right? The ludicrous idea that you would get a virus and not be better equipped to meet that virus in the future. It doesn't really square with reality. In fact, it's quite interesting. Before the COVID vaccines, there was high-level discussions at the WHO and elsewhere about immunity certificates, meaning if you got COVID, you would be granted the so-called green pass, and the other people who didn't have COVID would, have to be locked in their homes. Right? And then suddenly when the vaccines came around, immune status doesn't matter anymore. And I think that singular point was one of the most decisive miscommunications of the public health establishment. It was an error of judgment. And it reflects, again, going back to my earlier comment, this notion, this very paternalistic notion, right, that the government authorities and the government scientists, and I say government scientists, not scientists, right, people who have a very particular advisory role, and there's pressure to conform to the dominant thinking of the government. So there's effectively a sort of conflict of interest or groupthink that develops in these advisory groups. That they They failed in that regard. So yeah, I think that I know that there's a lot of I'm very aware of the vast literature on why people don't take vaccines. I've worked on vaccine programs. Typically trust in vaccines is correlated to socioeconomic status. Why is that? Because people that are lower down on the socioeconomic ladder have been at the brunt end of arbitrary government policies. They've experienced difficulties in their life. They've experienced people not caring about them. For example, I have a family member who was tragically disabled from a Pfizer pharmaceutical product, not a COVID vaccine, right? They did not want to get vaccinated. Are they unreasonable? I don't think so, right? They fundamentally, I mean, Pfizer is actually as a corporation, they've paid some of the largest corporate fines for fudging pharmaceutical clinical trial data. And yet suddenly we all need to believe them. I mean, that's not how you build trust. The studies on trust show being transparent, accepting uncertainty, being honest, right? You might have less of an uptake on a vaccine in the short term, but long term, you're going to increase your uptake on vaccines because people actually believe that what the government is saying is real. And I think that just this notion that you don't have to be real with people has backfired, and it's going to continue to backfire if public health doesn't reform itself and sort of accept that it is functioning in a democracy for the citizens of the country that they're working in. So yeah.
Great points, Kevin. We're going to take a short break and be right back. Welcome back to Our Canada, Our Future. We're talking with Dr. Kevin Bardish at the University of Washington, talking about trade-offs from COVID restrictions and vaccine mandates and passports. I guess first, Kevin, I kind of wanted to play devil's advocate. There were a lot of people that made the argument of these measures were necessary. It's sort of Monday morning quarterbacking to second guess them after the fact. What do you say to those who say, yeah, maybe there were trade-offs involved, but it was still the right decision, and people who are claiming otherwise now are engaging in sort of revisionism?
So there's a lot of ways I can answer that. One is I could point them to Austria, which had the first population-wide mandate that they implemented. If you look at the actual uptake of COVID vaccines during that time, from before they announced it, so when the public knew that they were going to announce it, up until they rescinded the vaccine mandate at a population level, there was very little uptake of COVID vaccines. People reacted with what's called reactance. If you're going to try to take away my freedom, right? I'm going to fight you. I'm going to try to get it back in a different way. So I would say that there's a lot of examples that you can point to where these policies backfired. Also, a lot of countries didn't take them. The UK did not mandate vaccines. They tried to mandate them in healthcare workers. The healthcare worker unions, etc., protested, and they declined. They went back on their policy. I would also say that you have a very, speaking to this hypothetical person, you have a very interesting position because tracking political polarization from one policy is very difficult. So I'm sure you can put your head in the sand and ignore this particular effect, right, on the way that sort of people have reacted. Although I would counter that with the following statement, which is quite an ironic situation. We wrote this paper, started writing it in December of 2020, right? We released it a few days before the Freedom Convoy started in Canada, right? So our comments here are essentially predictive. We were feeling the national pulse, and not just national. This was sort of a European-wide and North American-wide sort of social movement, right, against these mandates. And I think it's completely intellectually dishonest when other academics, the media and others, smear this as a right-wing sort of anti-science movement, okay? It was very eclectic. People who, like myself, right, or appreciating the protection of prior infection and disagreeing with mandates, not vaccines, right, were suddenly lumped in as sort of racist misogynists. A quote from Trudeau, our national leader, who supposedly is concerned with national unity and social justice. I mean, this sort of backflips that people are making with the claims is mind-boggling, and I think it's unacceptable. So I would say also that we know the age-based distribution of COVID mortality and bad outcomes. Had we focused on vaccinating the most vulnerable groups, okay, we would have avoided the political polarization and things like the Freedom Convoy. In fact, I wonder how many elderly people refused to get vaccinated because their younger family members became skeptical of COVID vaccines and convinced them, let's say, to not get vaccinated. I mean, there's a lot of, obviously, social complexity here.
Right. Maybe we could touch on the political polarization point, because I think that's obviously something that's germane right now. There's a lot of concern about rising anger in society. I think this was probably happening before the pandemic, but the pandemic has arguably sort of supercharged the political temperature in a lot of countries, and Canada's no exception. What's your take on the sort of impact of these measures on the sophistication or calmness of political debate in Canada?
I think it's backed people into strange corners that they feel like they can't escape from, and the government needs to be held accountable for its policies, which I think were unscientific and misguided. In fact, when the Freedom Convoy started, I tweeted out, I mean, I'm not by any means a political advisor, but I had the idea that had Biden called Justin Trudeau and said, hey, Justin, let's call off this cross-border trucker mandate for the vaccine, it would have been a brilliant political move, because the US also experienced significant backlash, right? And I think the Biden administration and the Democrats are going to feel that in the polls this fall, I mean, amongst sort of mass sort of school closures and a lot of other policies that they pursued. I think there were ways to back out of this when it was obvious that the vaccine was not a magic bullet. And when, the sort of feeling of the public was well known. But that's not what Justin Trudeau and the Liberal government did. They doubled down. And I think that sort of, a disjunction between fact and the fictions that they started to sort of propagate became well known and is now a cause of a lot of anger.
Yeah, fair enough. Well, Kevin, very fascinating conversation today. You've done a lot of interesting work on this, and I look forward to seeing more of it. I want to thank you for joining us today, and I want to thank you, the viewers, for joining us. We'll see you next time on Our Canada, Our Future.